Stapon.
Madam Deputy President, in the late 1960s and 70s, a company, D. Jansen & Co., known as Mr Fluffy, installed crushed amosite asbestos insulation in roofs in houses in Canberra and Queanbeyan and the southeast region of New South Wales. Over 1,000 houses in Canberra and an unknown number in Queanbeyan, Jindabyne and other parts of southeast New South Wales had this insulation installed. During the 1980s, the danger of this loose fill insulation, far more dangerous than bonded asbestos or other forms of asbestos, was recognised, and Canberra houses had around about a $100 million federally funded program to remove the asbestos from their roofs. New South Wales houses missed out on that program. Early in my first term as member for Monero, I was contacted by a number of people in Queanbeyan and Jindabyne who had this loose fill insulation into their roofs. At the time, the advice from the New South Wales Department of Health was that if the asbestos was sealed into the roof spaces and the roof spaces were sealed, then it was safe to have in the house. It's very clear from recent evidence in Canberra that this advice is no longer correct. The Canberra studies recently have shown that even in houses where asbestos has been removed from the roofs, tests are still showing asbestos fibres present in other parts of the house, in the wall cavities, in built-in wardrobes, in living areas, coming through ducted heating and cooling systems and so on. It's a threat which has meant that in the ACT at the moment, the ACT government has been talking to the federal government about a new package of assistance to potentially demolish houses affected or to look for other solutions. So far, several families have actually had to move out of their houses in Canberra and several houses have been demolished. Unfortunately, across the border in Queanbeyan and surrounds, we still have the situation where there is people living with asbestos fibre insulation, loose fluffy insulation in their roofs. This is a situation which is now untenable. The New South Wales Department of Health is still providing the advice which says that, that both the ACT and New South Wales agree on the health hazard posed by loose fill asbestos insulation, which, I quote, only becomes a risk to health if an exposure pathway exists that allows the inhalation of airborne asbestos fibres. In 1993, the New South Wales Government evaluated the level of risk posed by loose-filled asbestos in 7 homes identified at the time in Queanbeyan, New South Wales. The assessment concluded that exposure to asbestos is likely to be very low, provided the asbestos is undisturbed and sealed off from the living areas. Well, Madam Deputy President, we're now getting to the stage where the houses we're talking about here are quite old. It's been over 20 years since that advice, which the New South Wales Department of Health is still relying on, was actually formulated. And we're getting to the situation where many of these houses, if they haven't already been renovated, have changed hands to people who are sometimes unknowing what they're moving into, or situations where they are starting to have parts of roofs breaking away, or even in danger of further damage in storms or disasters. It is simply not adequate anymore to rely on a 21-year-old study to say that these houses are safe. The federal government, if it is to come back in and assist the ACT in addressing this problem, must not ignore the people of New South Wales. The federal government, is now been revealed, was aware of this problem in 1968. And the ACT Health Services branch of the Department of Health, which was then a federal government agency, said, and I quote from a letter from Arthur D. Spears, Acting Director, "It is considered desirable that D. Jansen & Company Proprietary Limited should be dissuaded or even prevented, if possible, from using asbestos fluff as insulation material in houses. Not only are men being unnecessarily exposed to a harmful substance in the course of their work, which is against the best public health practices, but there is evidence that the community exposure to asbestos dust is undesirable." Now, it's very clear that the federal government was aware of the problems. Unfortunately, this company was allowed to operate. It is not really fair to say that it is any single government's fault in this, and it's probably why it's taken so long to address. But it is clear now that the new evidence in the ACT, that the new tests that are being done, make this problem something which needs to be addressed. And I would urge the New South Wales government to actively pursue discussions with the federal government and engage in finding a solution for the people of the southeast part of New South Wales so that they aren't ignored once again in addressing this very serious public health problem.
Mr Buckingham.
Thank you.